Back here on the Saturday morning Sports Medicine Weekly. Steve Kashul with you. My co-host this week, filling in for Dr. Brian Cole, is Dr. Nick Verma. He is the head team physician for the Chicago White Sox, one of the team physicians for the Chicago Bulls, and various other sports teams, and also orthopedic surgeon from Midwest Orthopedics at Rush. Time now for our Ask the Doctor segment on Sports Medicine Weekly, giving our listeners the opportunity to have our doctors address their specific sports injury issues. Very easy to get involved, folks. Go to our website, sportsmedicineweekly.com. On the homepage of the website, look for the picture on the right side of Dr. Cole and yours truly. Click on that link, and you can ask the doc a question. Got a couple good ones for you this week. Ready, Doc?
Let's hit it.
All righty. First question, what are the most common winter weather-related injuries that you see in the office?
Great question. This is a busy season for us, and let me tell you, the office is certainly full of them. I would say the top three things that come into our office during this time of year are, number one, slip and fall on ice. Number two is skiing. And number three is shoveling or some exertion-related issue from people doing something that is outside of their normal work capacity, meaning you're generally sedentary, you don't do a lot of physical activity, you're not at the gym, and all of a sudden we get a heavy snow like we had a week ago or so, and you got to go out and shovel your driveway. The slip and falls, we see a lot of shoulder injuries. If you can imagine, when you slip and fall, it's not unlike on a football field when you get tackled and driven to the ground and land directly onto your side. So some of the things that we see are fractures. You can fracture your collarbone. You can fracture the top part of your shoulder bone, which is called the humerus. We see shoulder separations, which is, again, another common NFL injury where you actually have a displacement between your collarbone and your shoulder blade. And then as we get over the age of about 45 to 50, by far and away the most common thing that we see is a rotator cuff injury. And I know you've undergone some surgery on your shoulder that partially involved the rotator cuff. Steve, I know you've talked about it on this show. But generally, these are injuries where somebody falls on their shoulder, they tear their rotator cuff, they can't move the arm, and oftentimes that necessitates a surgery in order to repair the rotator cuff back into place to, A, eliminate pain, but also, B, improve function. On the skiing side, far and away, ACL, ACL, ACL. These are the ones that we see. Typical mechanism, they're skiing, they've got a rotational event, the binding doesn't come loose, the knee twist, they feel a pop, pain and swelling. And you can almost diagnose those just from the history that they give you. And when they come in limping, they've got a swollen knee. It's pretty much an ACL until proven otherwise. Prevention strategies are a little bit more difficult on the skiing side. It's really about making sure you've got proper functioning equipment, you've got properly fitted equipment, you're keeping track of in terms of your skill level versus the degree of difficulty for the terrain that you're on. And, you know, at this time of year, unfortunately, crowds are one of the big issues. We just got through the holiday season, and crowded slopes can be dangerous slopes, so just keep that in mind when you're out there. And then finally, shoveling, you got to just use some common sense, recognize what you've done before, where your body level is at. Not only is it a musculoskeletal concern, but oftentimes cardiac concerns are a big issue. We hear about all the time, and you'll see news segments about people that actually go out and have a heart attack from shoveling snow. And I think for those of us who have done it, you recognize the amount of physical exertion, especially if you get that wet, heavy stuff that can really take a toll on your body, your upper extremities, your low back, but also your cardiac system. So just be safe.
If you haven't worked out in a year, don't go do it and try and shovel the driveway in 40 minutes.
Get a snowblower or get the kid next door to help you.
Exactly. It'll be worth the $25. Again, we're Dr. Nick Verma, Steve Kashul here at Sports Medicine Weekly on this Saturday morning. Our Ask the Doctor segment. Question number 2, and I know a little bit about this, but you can be the expert, Doc. What is the difference between acupuncture and dry needling? I've had the dry needling done on my shoulder, and I highly recommend it. I thought it was terrific.
Yeah. So my first disclosure here, Steve, is I'm not an expert in Chinese medicine, but I'll give you the basic overview. Acupuncture is really based about this Chinese medicine concept of qi, which is identifying certain areas or trigger points in the body that may affect various body symptoms. And it's not limited to the musculoskeletal system. So, for example, you may see an acupuncturist because you're having frequent heartburn, or you're having anxiety, or you're having back pain or shoulder pain. And even though your symptoms are in your shoulder, for example, they may say the pressure point based on Chinese medicine for the shoulder is actually in your foot or in your pelvis. So the location of the treatments that are being administered are not based on the location of your symptoms, but really based on, again, this Chinese concept or Chinese medical concept of qi, which is where certain areas or certain trigger points control other systems of our body. And so it's a very unique aspect. There is actually good data and certain conditions that support that it can be used. It's very helpful for not only the medical side of it, but the relaxation side of it that goes along with those treatments if you've ever had them. Dry needling is very much more so about musculoskeletal. So if you've got a sore shoulder, they're going to identify points in your muscle where you've got tension within the shoulder itself. And by inserting small, very small needles, not unlike acupuncture needles, but they're going to go directly into the muscles that are affected. And the idea is to try to stimulate muscle relaxation and thereby a healing response. So I think they're very similar in terms of what you feel and how the procedure is performed, but they're very different in terms of the concept of how they're being used.
Yeah, following my shoulder surgery performed by Dr. Brian Cole last February 19th, following a couple of months of rehab, I did the dry needling. And it was, I found it fascinating. It didn't hurt, that little pinch.
Very, very
but
tiny.
then, boy, it's a little weird when you first do it because it's almost like a muscle spasm, but they're getting the knots out of the muscles, and I could feel that thing go right through my arm and shoulder, but I swore by it. I thought it was great.
It absolutely can be helpful.
Okay, great stuff. We're out of time. Dr. Nick Verma, we thank you for joining us as our co-host this week on Sports Medicine Weekly. Wonderful job, continued success with the Chicago White Sox, and we will hopefully see you down the line again real soon.
Thanks, Steve. I appreciate it.
Okay, and our producer, Shane Reardon. Our coordinating producer, as always, Tracy Toro. Also want to thank David Cole for managing our website, which is sportsmedicineweekly.com. He also handles our business operations. And then we thank Samantha Smith from Midwest Orthopedics at Rush. For Dr. Nick Verma, I'm Steve Kashul saying so long. Thanks for listening to Sports Medicine Weekly here on The Score. Up next on The Score, Early Odds with Joe Ostrowski. Talk with you next week for a brand new edition of Sports Medicine Weekly, only on 670 The Score.